Hello YouTube and welcome back to my channel. In today's video I'm going to share with you the most common mistakes I see people make post ACL surgery, so hopefully you don't make the same mistake too. Mistake number one is not having a therapist to work with straight after surgery. Don't wait too long to find an expert. You can often get a month down the line or 4 weeks down the line and you've been doing these generic exercises off a sheet that really won't cut it. Make sure prior to getting surgery that you look around for a therapist that can help you post-surgery, somebody that specialises in ACL rehabilitation and that can offer you lots of advice and support pre-surgery and post-surgery. My patients, for example, work with me prior to getting surgery. We take some testing numbers, we take some baseline measurements, but they also get an ACL welcome pack, which is all of my handy tips and tricks in one PDF document. This is how to manage swelling, things to remember to do, things that you can purchase prior to getting ACL surgery that will make your life a hell of a lot easier. Second mistake that people make is resting with a pillow under your knee. Trust me, this has a much bigger effect than you think. We as therapists don't just tell you not to do it because we want you to not sleep or not rest. It really does hinder and kind of halt your recovery. Resting with a pillow under your knee roughly creates around 10 to 30 degree bend. We are constantly post ACL surgery trying to chase extension, whether that's lying down or in a standing position. Resting with a pillow under your knee is really counterintuitive to this, and that will make so many more things harder, like contracting your quadriceps, for example, walking around, and number three, getting rid of swelling. It's harder for swelling to go when your knee is that packed up with cushion. So make sure that you are elevating your leg in line with your heart and there is nothing under that knee. I know it's uncomfortable. I've had 3 surgeries myself and 1 ACL surgery. I totally know how much more comfortable it is to rest and to sleep with a pillow under your knee. But trust me, it literally can add so much longer to your recovery and make things so much harder. The third thing is not starting exercises straight away. There are so many people that message me or reach out to me on social media, hey Tilly, when can I start doing exercises? I've taken the bandages off and I'm going to get my stitches out, shall I start exercises now? That is a big problem. We need to start exercises straight away. Literally the moment your eyes open, start squeezing your quad, doing ankle pumps. Try to get the blood flowing to your knee, but equally try to get some kind of movement. As soon as the bandages are off, it is easier because you can see what you're doing and your quads are kind of moving and you can feel things much better. But it's not an excuse to not do any exercises just because you have a bandage on. Especially don't wait until you get your stitches out, because for some people that's 2 weeks, and if the post-op appointment gets cancelled or missed, you're often waiting even longer to get the stitches removed. And if you go 2 weeks with no exercises, that is really going to hinder your recovery, and your quads will waste even faster than they already do when you have good ACL rehabilitation. The fourth and final thing is coming off your crutches too soon. I know that they're annoying, I know everybody wants to get off them, but you really are making it harder for yourself if you come off them too soon, because our gait is disrupted anyway, and it gets even worse because you're all of a sudden just limping even more on your leg. You're not fully extending your knee because you don't trust it, because your quads aren't active, and you're shifting onto the opposite side, or you're just shearing at your hip, and you can be much more prone to getting hip pain, lower back pain, and that is just not what you want on top of ACL recovery. It also just slows down your quads inhibition as well, so the quads just don't work as well because we're not fully extending that knee when we're walking, and the hamstrings get no kind of action because we tend to just drag and stomp the leg down. So stay on those crutches until you have a near on perfect gait and you're comfortable and confident to come off them. Please do that under the supervision or the guidance of your therapist. If you found these tips useful, you can follow me on Instagram, where I post lots of daily information, tips and tricks on ACL rehabilitation, but I also have my complete ACL recovery guide, which will take you from pre-surgery with all of the essentials that I suggest you buy, the things I suggest you do, links to all of the exercise equipment you're going to need for your rehabilitation, and then you have your day one exercises right through to return to sport. This is a complete ACL recovery guide with all of my tips and tricks and exactly what I use within my clinic. The full gym programming to get you back to running safely, and then how to integrate back into your sport. So if you want to check that out, please head over to my website, which is specialistsportstherapy.co.uk. And if you have any questions regarding that, feel free to reach me on Instagram, where I'm more than happy to answer any questions that you may have. If you've liked this video, please like and subscribe, and I sincerely hope that the content it's been recorded in and uploaded is much better than my other ones, but we all start somewhere, hey, and it's better than not starting at all. See you in the next one.